Did you know that in countries like Spain, Italy, and France, about 10 to 15 patients of confirmed cases of coronavirus are medical professionals? The New York Times.
So as we know, all this pandemic, the COVID-19, has been affecting many countries in the world, not only Iceland, but also in America, Latin America, Europe, and Africa. And we all also noticed that we have been not ready for such a problem. This is why we have been running out of the tests, not having enough equipment to diagnose, and having also other problems in the economy and politics. And this is how the idea came. We thought about why not using the artificial intelligence to develop a tool that helps the government find out who has the virus in a shorter time, and also without spending so much money on the tests and on the staff working in the hospitals.
That was we created Dimai. Dimai is a medical images classification system with artificial intelligence to complement the doctors in their diagnosis and interpretation of chest radiographs, which can detect if a patient has COVID-19 thanks to the radiological pattern. Dimai analyzes the images and can detect if a patient has COVID-19 or other lung diseases, such as Atelectasis, Pleural effusion, Pneumonia, and of course, healthy patients. So, how Dimai works? The system analyzes a database of radiographs using an algorithm created from deep learning and convolutional neural networks. It makes a diagnosis from the pixel distribution of the images. But what is exactly Dimai? Dimai is a web system that can be used from any device in a hospital with an internet connection. What are the advantages to be a web system? The system will not need specific hardware features, medical personnel will not need training to use it, and the cost of using it will lower to the hospital thanks for the on-demand business model. Who can use the system? The system can be used by any health professional and not only by radiology professionals. So, what is the impact of this project on the crisis? We believe that our project will have an incredible impact on this crisis. The developing countries will be able to make massive country diagnostics at a low cost and fast. We will provide a tracking to get more information, the actual numbers of active cases, and the more developed countries will know if their actions are working, and it will make a gradual exit from the lockdown. That it means the governments will reactivate the economy. So, what is our project vision? We already made our platform. We already complete the database with 80% of sensitivity. The next for us is to make system tests on Colombia, Mexico hospitals, and eventually expand our system to other countries in Latin America and Europe. After that, we will develop a new version with other AI diagnoses like cardiograph analysis and ultrasound analysis. We want to be a pioneering company on use of AI in medicine. And after 2 years, we want to make a profit of more than $500,000 per year. So, what have we done this hackathon? As I said, we reached the 80%. The 80% of effectiveness in COVID-19 detection, the 77% in Atelectasis, the 98% in Pneumonia, and the 86% in Pleural effusion. In the last week, we have accumulated a database of more than 100,000 radiographs and with 50 different pathologies. So we are working to add these new pathologies on the system. We have made the development of the web system, and we made a chatbot.
For the chatbot that we did put in the website. So this chatbot helps people to find out answers for questions about the project or about the pandemic.
We improve our business model. We contemplate Czech Republic and the other European countries with Bismarck health system on our business model.
pandemic. Thank you so much for listening.